Hi everybody, it's Adam and we are at the Heart Valve Summit in Chicago, Illinois. We're answering your questions that were submitted across our website, Facebook, and all other places on the internet. I'm thrilled to be here with Dr. Robert Bonow, who is a professor of cardiology at Northwestern Medicine. He's also the program director of the Heart Valve Summit. Bob, thanks so much for being with us today.
Thank you very much, Adam. Great to be here.
Yeah, and we're going to be answering a question that came in from Karen. Karen writes, I am now approaching my 4th anniversary of mitral valve repair, tricuspid valve repair, and ASD closure. She asks, are there things we should be aware of as the years go by as patients? And how often should we have things performed like echocardiograms, dental prophylaxis, blood thinners, and any blood work? Bob, your thoughts on that?
Well, great, Karen. These are important questions, and they're questions that I address with my patients every week. I mean, it's right on the mark. Now, some of that depends on other things that you know about yourself, Karen, that I don't know. Your age, your other medical issues, and everything else that gets built into you that you discussed with your doctor, and since I'm not your doctor, I don't know those details. So in general, depending upon your age, if you're otherwise a healthy person, then go for it. If you had a good mitral valve repair, tricuspid valve repair, the ASD has been closed, your heart's functioning normally. We do this to allow people to lead normal lifestyles. That's why we also recommend many times intervening early to prevent there from being any heart damage. So assuming your heart is functioning normally at this point, again, I don't know that, but assuming you've had a great repair at just the right time and your heart's normal, then I would not hold back at all. I would encourage you to exercise, stay in shape. Remember that you've had some valve problems, but you also want to keep your heart healthy for all the other reasons that we want everybody in this country to be healthier. Eating well, exercising, watching your weight, watch your salt intake, lots of fruits and vegetables, the things we always recommend. As far as further testing, again, depending upon your own situation, if you've had an excellent repair, and like most of my patients have had good repairs, I see them in the office and I listen to make sure there's no new murmur that I can hear on my stethoscope. And if their heart sounds normal and they're feeling normal and doing all kinds of normal stuff, it's easy because I don't need to do a whole lot of extra tests. It's different when you've had valve replacements. Then you got to worry about the artificial valve and how long it's going to last and is it still functioning normally. But if you've had a good repair by an excellent cardiac surgeon, then that should be long lasting. And as long as nothing else is going on in the way you're feeling or what the doctor hears or sees with the physical exam, many times we don't need to do repeat testing. So all those echocardiograms you had done before your surgery, it's kind of a different ballgame after surgery for most patients.
Well, I hope that helped you, Karen. I know it helped me, Bob. Thanks for taking the time to share all the great things that you've learned over, how long have you been practicing for now?
40 years.
So if anybody can provide some great advice, which you just did, it is this man. And Bob, thank you for everything you've done for all the patients in our community. We really appreciate it.
Thanks, Adam. Thanks.